Healthcare providers want to be better connected, to have information at the moment they need it. But there are gaps in connections between physicians, hospitals, laboratories, patients, and payers. Using an agile development methodology, Humana is currently working with an innovative group of software engineers and physicians to develop tools that will help doctors take better care of their patients and run their practices more efficiently and effectively. Let's see a typical patient interaction in today's healthcare environment. Here's Dr. Randall.
It's 4:30 on Friday. Mr. Mendoza comes in and says he's coughing and feels tired and feverish. My records show a history of diabetes and asthma, and that he smokes and is overweight, but I haven't seen him for 2 years. I hear crackles in his lungs and think it could be pneumonia, and X-ray and the lab are already closed, so Mr. Mendoza, I'm sending you to the ER.
ER? Is it serious?
It may be pneumonia, and for someone who is overweight, smokes, and is a diabetic with asthma, it could be serious. I'll call the hospital.
But I quit smoking.
As a primary care doctor, I want to see every part of a patient's medical history, and it would be great if I could send today's notes electronically to the ER.
Now let's shift to Dr. Spence in the ER.
So Mr. Mendoza is in ER with no chart, just a phone call from his primary. Now, when a patient complains of fatigue and a cough, and then says his doctor diagnosed diabetes and asthma in the past, my choices are limited. I'm ordering an X-ray and labs. With your history of diabetes and asthma, we have to check for pneumonia. We're keeping you overnight. It seems there are a few other things we don't know about Mr. Mendoza. Evidently, he stopped smoking, and his blood sugar tested lower at a health fair. I wish I could see all that information.
Mr. Mendoza goes off to his room, where we meet Dr. Ralph, a hospitalist.
As a hospitalist, I need to keep costs under control, but patients are my first responsibility. I take Mr. Mendoza's history, order tests, and start antibiotics and fluids.
This is the third time today that I'm answering these questions. Why can't doctors share that information?
And the next morning...
Okay, Mr. Mendoza, your tests look fine. I think you just had a virus. You can go home, but see your doctor soon. I'd love to just send my discharge summary electronically and tell the patient's primary doctor when to schedule his next visit.
This is a common scenario. Without current information, there are unnecessary tests and delays, and neither the doctors nor the patients are really satisfied. At Humana, we're working to create ways for physicians and hospitals to share information so they can make better decisions and patients can have better experiences. So let's imagine the same scenario using the HealthLogix platform, which was developed using the Agile methodology.
Recent biometrics from a health fair showed me that Mr. Mendoza had lost weight, quit smoking, and lowered his blood sugar from 2 years earlier. But I was concerned about his symptoms, so I sent him to ER and contacted them electronically about possible pneumonia.
With information from Dr. Randall's records, I compared our test results with previous tests and agreed that he might have pneumonia. I sent electronic radiology records to Dr. Ralph.
Looking at new and old x-rays, what we thought was pneumonia was actually scarring from smoking. I sent Mr. Mendoza home and sent my discharge summary electronically to Dr. Randall.
And I didn't have to spend the night in the hospital.
As a company that cares for our patients and providers, we connect physicians across practices and delivery systems to improve the overall quality of patient care. The Agile process allows doctors to learn and respond quickly through close collaboration, adapt to changing needs, and improve the patient-physician interaction. HealthLogics provides relevant, actionable information about our patient population, along with quality scores and suggested documentation improvements. Bottom line, it helps us manage the health of our patients and populations, and it helps us to better manage the health of our provider practices.